The line forms where the first COVID-19 vaccines could be in Wisconsin by next week. And then comes that difficult decision of deciding who gets it first.
Yeah, there's that. Groups all over the state are making their case to public health officials. We have team coverage tonight on the COVID-19 vaccine. Madeline Anderson with the latest from the governor on distribution. But let's start with Fox 6 investigator Brian Polson on who might be getting the first injections after they are actually approved. Brian?
Hey, Ted and Mary, I am outside the North Shore Fire Department, which is home to some of the state's more than 54,000 firefighters. But are they firefighters or are they emergency medical workers? The answer could determine whether or not they are included in that first round, the top priority group for COVID-19 vaccinations.
What's the line? What do firefighters do? What do paramedics do?
Sometimes they put out fires, but far more often Wisconsin firefighters are responding to medical calls.
They're seeing COVID patients every day.
And North Shore Fire Chief Robert Whitaker wants to make sure the state of Wisconsin knows that as they decide who's first in line for COVID-19 vaccinations.
You're in people's houses, you're in their apartments, you're in small rooms with them, and then you ride in the back of what is basically a 6x8 ambulance.
I think we should consider them EMS.
Wisconsin's vaccine distribution plan puts healthcare workers and nursing home workers and residents at the top of the list.
The whole purpose of prioritization is to ensure that the most critical people get the vaccine first.
On Tuesday, a state vaccine subcommittee said it expects Wisconsin to get about 50,000 doses of the Pfizer vaccine next week and another 16,000 from Moderna the week after that, an initial delivery that will cover less than 15% of the state's top priority recipients.
That's as much as we have for planning purposes.
60,000 doesn't go real far.
And yet the committee has been inundated with requests to add others to its coveted Phase 1A, from radiation techs to blood center workers, aides to disabled children and adults, food production workers, social workers, speech pathologists, childcare workers, prisoners, even the homeless.
To sort of add more and more people into 1A because they have some connection sort of with healthcare doesn't really help.
I actually just think that we have gone on the slippery slope.
The state's vaccine committee did ultimately recommend that police and firefighters who respond to EMS calls be included in Phase 1A.
Definitely a relief because there was a gray area.
The initial vaccine scarcity means even those in the top tier may have to wait weeks to get their shots. But state medical advisors say, rest assured, your dose is coming.
It is a matter of weeks to months, not years on this.
So now, in addition to firefighters who perform emergency medical services, the vaccine subcommittee recommended that in-home health workers also be included in that 1A priority group. That is a recommendation right now. It's not binding, but it will go before the full State Disaster Medical Advisory Committee on Thursday. Live in Brown Deer, Brian Polson, Fox 6 investigators.
Yeah, see what happens on Thursday. All right, Brian, thank you.